Good afternoon. My name is Kenneth Hartigan-Go, and thank you for inviting me to this session of the inaugural convention of the Philippine Digital Medicine, and congratulations to the organization. For the next 20 minutes, I would like to offer some personal views and recommendation based on past year's observation. As early as 2007, the World Health Organization has already cited ICT in health as one of the 6 building blocks of a robust health system, along with health governance, health human resources, health facilities and services, access to technology like diagnostics and medicine, and health financing. These comprise the 6 building blocks. Now, telemedicine is a new and evolving marriage of healthcare and technology. The current pandemic has revealed the fragility and the vulnerability of our health systems, which has forced a rather rapid expansion of telemedicine as a stopgap measure. Now, we have a unique opportunity to systematically grow telemedicine into the integral part of our health system. Now, it has the potential to allow us to reach many more citizens who currently have limited access to healthcare. Now, for today, I would like to focus on teleconsultation, the foundation of telemedicine. Teleconsultation can have many advantages. One, it is convenient, available to anybody with a phone and internet access. Patient can have among medical specialists, even those from different cities or countries. Traveling and waiting times can be reduced or eliminated, along with the need to take a leave from work. It can serve as a barrier against doctors who sell medicines directly to patients, which is in the Philippines illegal. Some doctors indicate they save overhead because no need to hire a clinic secretary. But there are also, shall we say, disadvantages. The major one is that the doctor's inability to conduct a proper physical examination. Now, due to this limitation, doctors may be even reluctant to issue medical certificates, and that might affect a patient. Second, patients must pay for the fees with taxes before an appointment is confirmed or guaranteed. Patients have little recourse if the consultation is unsatisfactory. The technology is not always easy to navigate for non-digital natives. At this time, neither the government nor the private sector has worked out any official standards or any guidelines to regulate teleconsultation. There are already some applicable regulations such as data privacy, but the guidelines for teleconsultation are neither comprehensive nor consistent with and are loosely applied. In contrast with the rest of the healthcare sector, which is we are one of the most tightly regulated discipline. We regulate professionals and their education, their competence through licensing, the manner by which health products are used. Now, in crafting guidelines, here are some questions we need to consider. First one, what regulatory authorities will be involved in standardizing virtually delivered medical care? And how will quality assurance be maintained? Second, who owns patient data, the chart, the records? Who has access to them? Can patients record conversations for their files? How will patient confidentiality, data privacy, safeguards be assured? Had you ever asked for a comprehensive record at a hospital or a clinic during pre-pandemic times? It's not easy. How about now? It should be more easy, don't you think? Some teleconsult platforms discourage issuing medical certificates for patient. Now, I recall an incident where a patient had possible AEFI, adverse event following immunization, from an administered COVID vaccine, but the LGU did not want to assess it. Instead, asked her to seek another doctor to provide clearance prior to her getting dose number 2. Now, in this kind of situation, what should be done? How can electronic medical records, this is the third one, how can electronic medical records be leveraged for the benefit of a greater number of patients? Who will conduct data analytics? How will interoperability be attained to maximize that efficiency? And then we can use it for evidence-based decision-making. Data science is already here with us, but are we utilizing it well? Number four, and this might touch a little bit of controversy, should prices of teleconsultation be controlled? Now, teleconsultation fee range from 1,500 to 2,500 peso plus taxes. Should teleconsultation cost less than in-person consultations since doctors are unable to conduct physical examination or probe more deeply? Is there a peer review consensus on how much to charge? I think there's none. Should follow-up consultation cost as much as an initial consultation? Is the hospital entitled to receive a percentage of the professional fee? How are official receipts to be issued? How are teleconsultations covered by HMO, Health Maintenance Organization? One of the HMOs I know is doing this, and there is overwhelming demand for consultation. The problem is there aren't enough health professionals to deal with the number of calls. Number five, how much consultation time is allocated to each patient? What is a reasonable period of teleconsultation? 5 minutes, 10 minutes, 20 minutes? Now, it's easy for us to say, well, it depends. But if you were the patient, it can feel rushed and that there may not be enough time for the doctor to fully explain the conditions, the medicines to be used, possible adverse effect. Then you line up the patients with a fixed schedule. But what happens when the previous ongoing online consultation went over time? How are you going now to alert the next patient, next in line waiting? So these are difficulties, no, that we have to think about. The technology is there, but there are many human factors that have to be taken into consideration. The number six, how will referrals to other services take place that can ensure a comprehensive patient care? How is this coordinated? The ideal would to have a group of practice, an integrated platform to make it easy for patients to migrate within a virtual site of clinical practice. Number seven, what venue exists for redress by patients, given the greater possibility of incorrect diagnosis due to inability to conduct direct exams? What medical legal protocols will be put in place? I'd like you to examine this carefully because while the technology is there and there is a need for it now, if we don't create the right pathway to guide people properly, both the health professional worker as well, health worker as well as the patient, then we might get into a lot of trouble. During the pandemic, you ask yourself, have LGU health centers that traditionally hold in-person clinic consultation been able to pivot and do telemedicine consultation? With health staffers so concentrated in doing COVID duties and work, it appears not. Now, think about how hard it is for patients to get help or even some level of reassurances these days. With doctors notoriously reluctant to share contact information, how do you think the patient will reach the doctor for follow-up? What other recourse is there? Now, for disclosure, I volunteer at the Office of the Vice President Bayanihan Teleconsulta or e-consulta. I'd like to think it is helping many people who can neither afford nor access their regular health care. Now, in my experience, I have found that patients outnumber volunteers' capacity to respond. Some of the patients have had to access, have had no access at all to previous medical advice and don't know what to do regarding their condition. Remember, we have been locked down for quite some time, a year and a half. Others call seeking second opinion. Now, we frown upon this, but what can we do? They need a legitimate consultation for help because they're not given a proper explanation perhaps in their first consultation. Many cases are not COVID related, and the patients welcome being able to consult without leaving the safety of their home. Among the cases which are COVID related, these are often mild and indeed can be managed at home. But the patient's LGU did not give them good advice or attend to them, contributing to their stress level. We've seen some of them. Imagine coordinating with the patient and their family, and that patient, of course, is isolated in a room for PCR tests, portable X-rays, access to oximeter, to antiviral medication, oxygen tanks, sometimes even forgetting a regulatory gauge for the oxygen tank. This level of coordination goes beyond medical help, but has to be done anyway because this is right in the middle of a consult. I offer 3 solutions for the Philippine Digital Medicine Society for consideration as you will be shaping the landscape in the Philippines. First one, under public health crisis, this health crisis in particular, the government can initiate the engagement of non-doctor health worker to fill in the teleconsultation gap. Imagine a virtual ER triage system. What can we do? Given the shortage of volunteers, can a nurse practitioner be allowed to train to provide teleconsultation services alongside a medical doctor? Are we medical doctors willing to let go and accommodate them for patient care? There is much room for growth indeed in this field. The potential for the patient and the practitioner is immense. The second recommendation I have for the society, we hear about frontliners being overwhelmed by the COVID surge. Though we don't hear about doctors who are unwilling to do frontline work. But many of the questions COVID patients have are not necessarily medical in nature. We have now an untapped resource of over 2 million COVID recovered patients. Would it be possible to create a support group system in which the recovered COVID patients can offer advice, coaching, or hacks that they found helpful in managing themselves for their COVID at home? What to expect and how to alleviate the worry and suffering of a currently afflicted COVID patient. Now, this can take the form of regular webinars, a platform for those who have been tested positive for COVID to access helpful and practical information. The third recommendation I have is this. Patients are looking by and large for integrated solution. It's part of their journey. They're looking for integrated solutions. So think about value chain. These components are finding the right doctor. Now, mind you, a GP is as good as a specialist in many contexts and situations. After finding the right doctor is booking the doctor, paying, getting the consultation itself, the timing and integration with laboratory examinations, the integration with pharmacies for their prescription, the follow-up consultation through text messaging to update the doctor of the patient progress. This last part is really important. As e-prescriptions are gaining acceptance, can telepharmacy consultation also increase the number of drug outlets for the improvement of access to medicine, which, by the way, is one of the 6 building blocks I indicated earlier. Now, doctors and nurses, pharmacists, and other practitioners will benefit eventually from advancing innovations in fields such as radiology and physical rehabilitation, as well as in continuing education of the various subspecialties. Finally, we must be vigilant to include those who might fall through the cracks of this new technology-based practice. What can we do? There are a couple of steps. And in conclusion, helping the poor and vulnerable and elderly navigate the necessary technology to access available health services. Navigating through a technology may be easy for some sectors of our population, but there are still disenfranchised population, subset of the population who will find it difficult to navigate. So let's help them. The last recommendation is ensuring that everybody has the equipment and stable IT connection to participate in this practice inclusively. Without right equipment and stable internet connection, you will be frustrated, and patients will also be frustrated in this interconnectivity problem. So as you can see, the enterprise architecture has to be there. The doctors and the patients should be willing to embrace this technology so that their patient journey will be much, much better. So I end my talk, and again, congratulations to the Philippine Digital Medicine Society, and thank you for inviting me.